So just a quick word about what is the Human Values in Healthcare Forum. So actually was set up in the 1980s by a distinguished group of doctors and a social scientist who, in fact, it all started with them reading the Nazi doctors and thinking, my God, could the medical profession somehow get corrupted, or the healthcare profession? It went from there. So I was chair for 10 years, and around 2015, it sort of went into hibernation. So we reignited it as a charity, and our broad mission is to be part of a movement, really, to humanize healthcare. And we do that by supporting and collaborating, as with this center, with those who are working to promote human values in health and social care, and actually also to highlight and challenge dehumanizing practices and policies. We aim to be a community practice and provide educational and reflective spaces such as this, and promote interdisciplinary dialogue. And we look at ethical issues and challenges in everyday ethics, but also ethical and social impacts of scientific and technological developments on relational care and values-based practice. Our values include compassion, wisdom, integrity, courage, and justice. And one could talk a lot about what are human values, but those are the ones that we very much want to promote. And we are finally a charity. Interestingly, the Charity Commission didn't think that wisdom should be included in the list. But I think there must be a huge amount of collective wisdom just in this room. Anyway. And so why this? This was I mean, actually, I've been quite preoccupied about this topic for many years. And, you know, how does AI fit in relational healthcare? And I know Rupal will be talking a lot more about this, but just sort of reflecting on my own experience as a doctor for over 40 years, and as a therapist for about 15 years, and as a coach and mentor, mainly for healthcare professionals, for about 20 years. You know, just thinking that it's the relationships that has given me so much meaning and fulfillment in my work, and the absolute value of trust and attunement in being able to attune to others. And my own life world, to use Michel's term, has expanded so much in engaging with the life worlds of others. And I've learned so much from my patients, and who've had to face enormous adversity and how they cope with that. And so for me, it's been a truly wonderful experience and acquiring wisdom. And then just to mention the haptic dimension, I have written about this, and I'm hoping to do some more research on the importance of touch and the clinical examination in the healthcare context, in general practice in particular. And then finally, it is actually more efficient and effective, and I'm sure we'll hear more about this, in that you can save time. You know what the lifestyle and the circumstances of your patient. They trust you. You can get quickly cut to the chase. What is it that they're coming for today? And we know it's more effective. And there was a document brought out in 2021 by the Imperial College of GPs entitled "The Power of Relationships." And as Martin Marshall says in the preface, if relationships were a drug, NICE, National Institute of Clinical Ethics Excellence, would mandate their use. And just very briefly, the power of trusting relationships. We know that for patients, it improves their experience. We know that, well, rather euphemistically, engagement with advice, i.e. they adhere to the treatment that you recommend, and their health outcomes are improved. And for clinicians, as I've mentioned, is more job satisfaction, recruitment and retention is improved. And we also know there's reduction in prescriptions, A&E attendance, actual mortality and costs. And so really, one of the questions is, what can AI offer for relational care and the therapeutic relationship? And that's something that we'll be exploring. And then actually my son, who's a bit more versed than I am, did ask the questions that are on the program, and what does ChatGPT have to say about it? And if you're interested at the end, I can share that document with you.